Today we are in New York City because we were invited to visit Diamond District Dental, NYC, and with us now is Dr. K. Welcome to the show. How are you?
Thank you, Donna.
Your place is spectacular.
Oh, thank you.
From the moment you walk through the threshold, there's this feeling of elegance, this feeling of, calmness, cleanness. I like it very much. So you recently built this, correct?
Yes,
Okay, so when did you move in here?
about 4 months ago.
Okay, and how did you decide to design it this way?
Oh, it's been my dream to build a practice like that ever since I graduated dental school. So it's been about 25 years in the making.
Congratulations. I'm
Thank you.
really very happy for you.
Thank you.
What was it like going to NYU dental school?
It was grueling,
Okay.
but very exciting and intense. A lot of training and almost like drinking from a fire hose.
Okay. Very intense.
Yes.
I actually know a student there currently. So someone that my daughter graduated high school with, he's in their program.
Oh, wow.
And that's a really good description because it is
Yes.
intense. It's a lot of hours, but they do come out and you do have wonderful training
Yes.
from there. And so over the years, you've seen a lot of mouths, right?
Yes.
Yeah, a lot of teeth. Tell us about wellness. Why is it so important that people take care of their teeth?
Oh, it's super important, especially in the post-COVID world. We realize that there is a connection between the outside and the inside, your outside environment and your body. So the mouth is the gateway to the rest of the body. So whatever's happening in the mouth gets reflected inside your body.
Now, I knew about heart disease, but you also mentioned diabetes.
Yes.
So how is your mouth and your gums, how does that actually work?
Well, it has to do with the inflammation that's caused by the bacteria in your mouth, and the bacteria then invade and infect the gums, actually get into your bloodstream, and they travel to the liver and can affect the liver.
I guess.
I mean, that's a simple explanation.
Yeah, but in a way, I kind of understand what you're saying because, like, the grout in your bathtub, or things that have, like all of a sudden you realize you're like, oh wow, I should have squeegeed the doors because if not, then you get this gunk and it's harder to clean. I
Yeah.
guess a mouth is very similar, right? The longer you wait, and that's why they recommend. Is it every 6 months you should go get a cleaning?
That's interesting. That's not exactly true.
Okay, what is it now? What is the recommendation?
Well, it goes by individual patient.
Okay.
Okay, the 6 month thing was invented by the toothpaste industry.
Okay.
Where the jingle was, brush your teeth
Right.
twice a day and see a dentist twice a year.
Okay.
This is actually where it came from.
Okay.
So it doesn't have any basis in science or patient care. It's just, a jingle.
So sometimes people might need to have more frequent cleanings.
We have patients that have gum problems, periodontal problems. So we see them sometimes every 3 months,
Okay.
every 4 months, every 6 months.
That's good to know. So
Yeah.
maybe just an evaluation. So if somebody hasn't been to the dentist for a long time because of fear, I feel like they would be able to come here and that you'd be able to treat them with kindness.
Of course.
So they could not be, I think that's what it is sometimes. It's intimidating. People are still intimidated by the dentist, where really you just want to help them be healthier.
Yes, that's all we're here to do.
Do you have patients that have been with you for a few years?
Oh yes, yes. I mean, we get invited to like weddings and birthdays, and now it's even funerals sometimes. So it's really like this human element is what I think sets us apart from other offices, is because we actually treat the whole patient, not just the tooth.
That's important.
Yeah, that's very important to us.
I know that you also counsel your patients. Like you said, you have a good, it's not really bedside manner. I guess it's like called a chairside manner
Yes.
in your case, right? So you take the extra time to really get to know your patient, to work with them. And it's
Of
almost like a
course.
collaboration, if you will.
Yes, I mean, most of the procedures that we do are elective, but it's elective because the patient decides to do them. But it's important for us to educate the patient and explain why it is important to get certain things done.
Now you have a lot of state-of-the-art equipment. I mean, the nicest equipment I've seen. You have a beautiful, like, brand new, I guess, X-ray machine and things like
Yes.
that. So, is that like a 360? How does it actually work?
Well, actually, it's a 3D X-ray.
Okay.
It's a CAT scan, so it creates a 3D model of the patient's bones and teeth in the image.
I was asking you before because I'm an artist, and I thought maybe perhaps you would be an artist too. But you said all of your sculptures turn out to look like
Yes.
teeth.
Like teeth.
So this 3D X-ray helps you then determine, what might be happening, like under the gum where the bone is.
Of course. I mean, a simple X-ray is a 2D image which only shows you one cross section, and 3D you see a lot more stuff. You can diagnose much better. It's actually just a much higher level of service.
Are there any other tools that you utilize in this new practice, since everything's fresh and new, that you really feel like your go-to things that you like to work with?
Well, I mean, we have pretty much all the gadgets, but more importantly, is that it allows us to provide a much higher level of service. So we do have a 3D X-ray. We do have the same-day crown machine. We do have lasers. We do have special diagnostic equipment for occlusion diagnosis, which is the biodiagnosis. But more importantly, we use all these tools to give the patient the best experience and the highest level of treatment.
I was saying when I first walked in that I was reminded of my childhood dentist, Dr. Parrott, right? And I think that when you're able to have good dental care, or just be educated, or if a parent will take you and hold you by the hand and just let you know that wellness is so important, and it all starts with your mouth.
Yes.
I think that people could grow older and be healthier overall. I shared with you my dad. My dad's in his 80s, right? And so he ended up having to get dentures or apparatus or things of that nature. And sometimes if you start early enough, like maybe in your, would you say 20s or 30s, or through life changes, hormone changes, like when is it that somebody should make sure that they've got their mouth taken care of?
Okay, that's an excellent question.
Thank you.
And what I think, and the thinking in the dental community, is that we start the patient when they're about 3 years old.
Okay.
Okay. Pediatric patients like to see their patients at 1 year old, and between 1 and 3, of course, the parent takes care of all the oral health needs of a child. But at 3 years old, it's time to teach the person to take care of their teeth.
Okay.
And
Start young.
Very young, and it's very important to demonstrate, because kids learn by imitation. So if they see you brush your teeth and floss, they are going to fumble with it in the beginning, but then they're going to get to do it. And we have many patients now who are excellent dental patients who've never had cavities.
Wow.
Okay, because their parents taught them how to take care of themselves.
So they didn't have to
Yes.
get the,
Yeah. I mean, all the horror stories you hear from the older patients about going to the dentist are over. Most young people that we see have an excellent, fun experience in our office.
I'm very happy to have met you. We got a
thank
chance
you.
to learn about one another a little bit in your office and things like that. Your upbringing, your background, your kindness, your generosity of spirit, it shows in all that you do here. And I've only just met you like an hour ago. So
Oh.
Dr. K, kudos to you for
Thank you.
everything that you've built. And thank you. Thank you for having this visit with us today. Brushing. If somebody was going to get a toothbrush, soft bristles, medium bristles, hard bristles, what's your recommendation and why?
Soft bristles,
Okay.
and change it every 4 or 5 months.
Every 4 or 5 months, soft bristles. Okay. And toothpaste. Does it matter?
Whatever's on sale.
Paste, gel, whatever. That's not as important as actually
Yeah,
the
it's the
pressure.
mechanical. Yes, exactly. It's the mechanical action of the tooth bristles that controls the plaque.
Okay.
Unfortunately, tooth bristles don't get between the teeth, so
That's why you need a cleaning.
It's important to floss and see your dentist.
And see your dentist and see Dr. K. Thank you so much. It truly was a pleasure to
My
be
pleasure.
here. So nice to meet your entire staff.
Nice
and
meeting you.
Had a really good time. And now I feel like I want to maybe I'm just like, I want to go, I want to go get cleaned.
We'll get you.
We'll be right back. Thanks for watching.